They are currently chanting, "What do we want? Contracts. When do we want it now?" They are among the nearly 15,000 nurses across 5 privately run major hospitals who walked off the job earlier this morning. This is obviously a huge number of nurses, prompting New York Governor Kathy Hochul to declare a state of emergency, worried this strike could jeopardize the lives of thousands of patients. The key issues the two sides can't agree on include safe staffing for patients, healthcare benefits, protection from workplace violence, and wage increases. The impacted hospitals are Mount Sinai Hospital, Mount Sinai Morningside, Mount Sinai West, Montefiore, and New York Presbyterian. Both sides bargained throughout the weekend, but were unable to come to an agreement. The nurses union accused hospital management of putting profits above safe patient care, while in a joint statement, the hospitals criticized nurses for abandoning patients and called the strike, quote, reckless. Mayor Mamdani acknowledged the situation Sunday evening, posting a message that read in part, "No New Yorker should have to fear losing access to health care, and no nurse should be asked to accept less pay, fewer benefits, or less dignity for doing life-saving work." Again, nurses here at Mount Sinai just walked off the job. They will be joined by those at Montefiore and New York Presbyterian starting in about an hour at 7. And then we do expect to hear from the nurses union about the latest developments later on this morning at 10. For now, reporting live from Hell's Kitchen, Christina Fan, CBS News, New York.
Christina, thank you. Our team coverage continues at Montefiore Hospital in the Bronx, where nurses are set to hit the picket line in less than an hour. Aziza Schuler has been live there for us all morning. She has more details on how the strike could impact patient care. Aziza.
Good morning, Cindy. Well, bottom line for patients heading to the hospital today, despite the strike, hospital officials say that they plan to continue caring for anyone who walks through their doors today. Montefiore says it is planning to for what could be a multi-week strike. Mount Sinai and New York Presbyterian say they are ready to safely care for patients and keep appointments moving forward. According to Governor Hochul, the State Department of Health has staff on site at all affected hospitals for the duration of the strike to ensure patient safety and continuity of care. However, she is urging both sides to return to the table and reach an agreement. The New York State Nurses Association President Nancy Hagan is advising that patients not delay seeking care even as more than 15,000 nurses hit the picket line.
Going into the hospital to get care you need is not crossing a strike line. We are asking every patient not to delay any care. If they are not feeling well, they are sick, they need to go to the hospital. It's always good to the hospital that's nearest to you. And that's what we're asking our patients to do. We would rather be the one taking care of our patients. And there is still time for us to continue to take care of our patients if the bosses were to come to their senses.
Well, for now, hospital leaders and state officials say emergency care remains available. The emergency room here at Montefiore Medical Center is open. And just in the past few minutes, we've seen about a dozen charter buses move in toward the garage. We assume that that may be some of the nurses who are preparing to strike.